Well, you just did this incredible talk about AI governance. AI is coming into healthcare, but we need regulation, right? Can you just give us an overview of what AI governance really means?
Absolutely. So AI governance is having the processes, policies, oversight mechanisms in place in order to make sure that the healthcare AI adoption is safe and responsible. And the way I see it is governance essentially consists of 4 pillars in healthcare. One is people governance, because it starts with people. So what it means is having the accountability in place, having the upskilling the workforce so that they are trained on using the AI tools, building the right kind of workforce for safe adoption of AI in healthcare. So that's everything about people. Then we have processes, because you need to have the right kind of audits, right kind of escalation processes, certification models, assurance models in place in order to drive safe adoption. So we have the processes pillar. Then there is technology, interoperability, and all the technology infrastructure in place to support AI governance. And really the last pillar is data, because data, as long as you do not have the right data in place, governance is never successful. So all these pillars need to work in conjunction with each other and cannot operate in silos.
Yeah.
So it's very essential to understand that each of these pillars need to work together in order to drive successful AI adoption.
And what about what ethical considerations should we be looking out for
Absolutely.
with the AI? Yeah.
Sure.
Go ahead. Yeah.
So when it comes to ethical AI, there are a lot of nuances to it, but primarily it deals with transparency. The physicians, when they use the AI tools, are they really aware of what is the logic that's driving the decision behind, right?
Yeah.
So transparency, having the rules in place in order to address the inequities in healthcare, patient consent. So all these really drive ethical AI adoption in healthcare.
Super cool. And as AI is rapidly coming to our lives, do you think that regulation is going to keep up with innovation?
That's a great question. So what we are seeing right now, because we are all rushing towards this move so fast, and we are taking leaps and bounds literally every day, that it's, AI adoption and AI innovation is outpacing governance. And that's the reason why there are tons of lawsuits against insurers, because the same data sets are used by insurers and the health systems for opposing decisions. For example, insurers are using the same data sets, claims, EMR, utilization management, care management data sets to determine the the medical necessity, and they are denying the prior authorizations. And at the same time, hospitals and health systems are using those data sets for the reimbursement. So all of these are classic examples of failed AI because of lack of guardrails around it.
Yeah, absolutely. Well, thank you so much for your time. Nice talking to you, and great lecture, honestly.
Thank you so much. Thank you.